Right. Thank you again, Chairman. I think I'll finish in 15 minutes, this one, quicker one. For people who don't know UAE is just on the side of the Gulf next to Saudi Arabia. The main city is Abu Dhabi, which is the capital, and Dubai there, and Al Ain city, just a small enclave inside Oman. This is Tawam Hospital, which is the main tertiary center, to smaller extent, like King Faisal, and this is the medical school, which is at the end of this walking corridor, and it's linked to UAE University Medical School. That's what I'm going to cover in my presentation. I think this is taken from Chinese literature, that prevention is the best way of cure, and superior doctor, maybe like Dr. Khalid, is trying to do all his life to prevent the disease, while just middle doctor will try to work evidence-based, and the one catch-up doctor is just trying to treat the disease after it is there. So we hope that we all go to the top one and catch up with the middle one. Now this is an advert for Dubai. I'm not from Dubai, but this is a nice place. Sorry? It's not working? Better? This is the new and the old. This is Burj Al Arab, and this is Medinat Al Salam. I didn't touch it, honestly. Fine. It's working. Thank you, Prof. Now, 10 years ago, I have this case. 34-year-old, gravida 0, married for 8 years, primary infertility. She presented with large pelvo-abdominal mass, about 24 centimeter weeks in diameter. The only thing that she had primary infertility, and she's been treated a lot with clomid and injectable drugs. CAT scan, abdomen, and ultrasound suggested a large tumor taking the right ovary. It was thought to be large endometrioma. And we did laparotomy, right salpingo-oophorectomy, and it came out well differentiated endometrioid adenocarcinoma. The question came to my mind, is this due to the infertility treatment, or could be endometrial cancer develop on the background of endometriosis? I think over the last 20 years we used to believe that infertility drugs could cause cancer, and this is what I'm going to prove or disprove. Now, I think this topic is covered earlier on by a different speaker. This taken from American Cancer Society about sort of ovarian cancer prevention. So basically, when you look at risk factor, it could be associated, but doesn't mean that if you have the risk factor, you'll have the cancer. And you might have the cancer without risk factor. So risk factor simply say you are at higher risk of developing the cancer, but it's not causative relationship. So you might have many risk factor and you're lucky not to have it. And you might have no risk factor, but you might have the cancer. When you look at ovarian cancer, these are all documented as a risk factor. The older you get, the more obese you are, the more children you have, especially if you get your first child below the age of 26, and all protective. If you get your children after 35, doesn't protect anymore. Breastfeeding is okay. Birth control, taken more than 3 to 6 months, it will protect. Gynae surgery, I think Dr. Nesreen, or you cover this topic about gynae surgery prevention. Androgen will increase the risk of cancer. Unopposed estrogen might increase the risk of cancer. And there are a lot of really different syndrome which could be associated with ovarian cancer. I mean, just operated on Monday, a patient who is 27. She had already hemicolectomy, total colectomy, wibbles, and now she came for ovarian cancer at the age of 27. And where is Dr. Imad? The patient is desperate to keep her uterus and other ovary just for the dream feeling that she will get pregnant and have children. So after a lot of push, I did only salpingo-oophorectomy. at least you even die from 4 or 5 cancer, she will be happy and smiling than really feeling that her uterus is taken out. Where is Professor Khalid? He's not here. At least he will feel happy that he kept the uterus in these cases. Now the question, does fertility drugs cause ovarian cancer? And I'm talking mainly about Clomid and injectable drugs. This is a publication by Rob Bristow. Actually, Rob Bristow, if people who know him, maybe he's a top gynae oncologist in the US. He's one of the top 5 people in ovarian cancer. He did publish this when he was just doing his really fellowship. Basically, he looked at the risk of ovarian cancer after treatment of fertility, and there was possible association. And he mentioned that the non-ovarian risk factor of low parity and infertility could be the cause. So you're talking about patients who are already known to have low parity, and this put them at high risk. Given bit of injection make it even double. So it is the infertility cause the cancer, or it is the injection which cause the cancer. So basically his conclusion is that women with refractory infertility may constitute a high risk population for ovarian cancer, independent of fertility drugs. That was in 1996. At the same time, another publisher came to different conclusion. He presented some case report to say that ovarian cancer in women undergoing fertility raised question about potential neoplastic effect. And this was a place of debate for over 20 years. 30 years ago, we used to believe it have a rule. 20 years ago, we're still debating. But the evidence recently published in Cochrane. For people who are not familiar with academic work, you might have case control study, you might have RCT, different way to assess your evidence. But I think when it comes to Cochrane Database, maybe this could be the best evidence we have when it comes to crucial decision about causative relationship or risk relationship. So this Cochrane Database published in 2013, August, and they look basically about assisted reproductive technique. Does it increase the risk of ovarian cancer? They evaluated all the publication about this topic, and they did the really extensive literature search for 24 years. They looked into really maybe more than a few thousand publications and finalized them in smaller number which fulfill the criteria for Cochrane, RCTs, and outcome. The main result of this, basically, they have, I think, 11 case control study and 14 cohort study, and 7 of these are strong one to show no evidence of increased risk of invasive cancer. Well, other 7 case control show no evidence of increased risk of ovarian cancer, but 2 of them showed increased incidence of invasive cancer in subfertile women treated with fertility drugs compared with general population. So even with this group, there are some possible no effect to possible effect. But for sure, it came to say that even there is effect, it could be borderline ovarian tumor which arise in these cases. And they said that there is twofold increase. For example, in one cohort study, there was more than twofold increase in incidence of borderline tumor compared with the general population. So this, just to tell you what they went start with 5,000 publication, and they searched and they got another 102. So the number of all paper reviewed 5,600, almost 5,006, and all the records screened. And basically, after excluding the research or publication not suitable for the RCT and for confirmation of evidence base, they finished with eligibility 114, but only 25 of these are good enough to be quantitative and have reliable outcome. They start 5,100, they finish with only 25 publication which could use for this Cochrane analysis. Now, people who are familiar with Cochrane, basically, you are looking at odd ratio. You find that whenever the line cross the midline, that means there is no conclusive evidence. If the line in this case goes to the effect, you find the odd ratio is 2. That in this publication by Callan, He suggested that if you take infertility drugs, you might have two-fold increase in your risk of cancer. But really, the conclusive evidence of all of them together was not significant. That means fertility drugs will not increase your risk of ovarian cancer. So this is a 14 publication and analyzed in different ways. And as I said, for example, Shoshan, the odds ratio is 3.9, but still the line crosses the midline, so not significant. So you find that only one or two publications which shifted to the favoring effect of causative relationship. Again, different analysis, the odds ratio, you can see that here. This is Barazzini, odds ratio 3. That means it is shifted completely there, and he might favor that induction of ovulation cause cancer, but the total analysis of all publication came in the midline without significant deviation to favor causative relationship. Again, risk of ovarian cancer women treated with ovarian stimulating drugs, comparison infertility drugs versus no infertility drugs. So here, the analysis of the paper divided between drug versus no drug, clomiphene and gonadotropin. And you find that in the fertility versus no fertility, you find the line is nearly all of them crossing, only this one the same way said Kalam, which was shifted to favor causative relationship. Okay. And when you look at clomiphene, there is more shifting with crossing, which suggested borderline tumor, but all other study crossing the midline, so there is no significant powerful P to suggest its causative relationship. Again, if you shift at combination of clomiphene, gonadotropin, no significant effect or relationship, and gonadotropin alone, only standard suggests that if you give injectable induction of ovulation drug, you might finish with cancer. But as a conclusive evidence, do you have a camel market in Jeddah? Yes? No. Actually, one of the highlights of Al Ain and Dubai, camel market. And I have 3 professors from UK visiting to give lectures. We went to the camel market, and interesting, we thought we were watching the camel. But I think they came to watch us and laugh at us, really. And you can see them all coming to think what these people doing with us. So the conclusion, which is very simple and clear, due to the drug stimulating ovulation for various types from 1960, subfertile women are commonly exposed to these drugs, which may administer a high dose of long period for at least 1 year, 2 years. But the overall, based on 25 study with 182,000 women, we found no evidence that the risk of ovarian cancer was increased in women treated with fertility drugs. I think I'll take this as really conclusive evidence from this Cochrane Database. But here again, just to make something, 5 of the 25 showed increase in the risk of ovarian cancer, but these studies were of low methodological quality, and therefore, I think keep turning by time maybe, also I didn't finish. And therefore, the results are too unreliable to conclude that there is a definite risk relationship. I'm not sure if this will ever happen, because I think we have enough evidence not to support the view. We have evidence that it might work with borderline, but definitely there is no relationship that fertility drugs, so we can say no convincing evidence that fertility treatment will increase the risk of ovarian cancer. Thank you.